people don't realize quitting smoking is harder than quitting drugs. Even though nicotine is a drug, nicotine is one of the hardest ones to quit.
Yeah, so coming here to talk to Dr. Lamb showed me a few things in the health issue department that made it more of a motivator, but the physical aspect, just to feel better, was the biggest motivator.
I want to really get my diabetes under control, my A1C. So that's the main reason. And weight loss is one of the ways that can happen.
What worked for me this time was my granddaughter, who is 8 years old, said to me, and she's actually said this to me before, she has said, Gran, you need to stop smoking, you know, and I'll be like, yes, I know. And then she said to me one day, Gran, you have to stop smoking because I want you at my wedding. I mean, I think that, you know, this is a program offered through UNC hospitals for the employees. I mean, they do inpatient, they do outpatient. I mean, the program does not cost you anything at all. And the resources are wonderful, the medication, you know, whatever you need is tailor-made for you.
And we had some of the similar stories. The stories were real similar. It's like everybody had tried something over and over again and it just wasn't working, and we'd all tried different approaches. And so I didn't feel like alone. I felt like, oh, okay, they're having a problem too.
Besides the educational piece that I just spoke about, just the motivational part and knowing that I had an ally, not just somebody who could correct the things that I was doing wrong, but somebody who would empathize with, oh yeah, you had a difficult week, so you ate a bag of chips and that's okay, but now next time you get stressed, we're going to try this method and then we're not going to turn to food. And it just gave me alternatives to the bad habits I had formed over the 24 years of my life.
And also I think with the smoking is that just me being conscious of times and like when I are wanting to smoke or when I'm choosing to smoke, I think that's a big kind of deterrent, because now I'm conscious of it and I have a choice, right? You know, I'm not unconsciously doing it. So I think though I've absolutely noticed those things.
6 months ago, I had a patient who was hospitalized or went to the ER for COPD. It was the first time, chronic obstructive pulmonary disease, and has a long-standing history of smoking. And I think it really spooked him and made him alarmed about his health. And so that was a nice driving factor to help him add on support systems that he had not been involved in before, specifically nicotine dependence and some nicotine replacement therapy with some additional medication changes. Was able to quit smoking completely, and so things like his chronic cough that he had completely resolved. His feeling of just having kind of intermittent chest tightness during the week went away. Some shortness of breath. So I mean, just a number of different issues. And this is something that we talk about all the time, about how even though you've smoked for X number of years or months, that when you stop, that there's some really positive benefits, health benefits.
I'm just feeling more alive. I don't feel my age.
Because I just thought about restricting my food, but it was more so making changes to incorporate into my life and not be on a permanent diet, to just be healthier in general.
I was growing up, I used to have pneumonia a lot. Now I don't have any other respiratory diseases that I used to have back when I used to smoke. I know that.
I wasn't a person that ate a lot of fruit and raw vegetables, but I'm actually eating more raw vegetables now. Like I crave them, so.
You know, and I dealt with some really distressing things during the time I was trying to quit. And yet I did not falter, and I'm so proud that I stuck with it, because I mean, the physical effects that it has on you are amazing. You know, I can sing again, I can breathe again, you know, it's a wonderful thing.